Good morning, everybody, and welcome back to Insights from the Couch. As always, I am joined by my lovely assistant and partner in crime, Dr. Anamaria Ryan. Are we saying Dr. Anamaria Montenegro?
Not yet,
Not yet?
almost.
Okay. All right. But an
Thank
introduction is
you.
going to be coming soon, I'm guessing.
Thank you. Yes,
All
hopefully.
right. Looking forward to that transformation for sure.
Amen.
And myself, Yalily Smith, owner of the Traveling Therapist, Dr. Ana Maria, owner of Seven Counseling, is joining me today for. I feel like it's the final installment of the trauma series, but it's like I opened a whole can of worms after reading this book, so I don't know. But um, today we're going to actually finish up our trauma series, possibly, hopefully, I think, um, by going over 5 top points that are listed on an amazing book that we've been reading called The Myth of Normal. This book um, is by Dr. Mate, is the Bible of trauma. Like, it's 33 chapters long. It's 17 hours of listening. It's very, very in-depth, and it covers trauma top to bottom. It covers everything from the way trauma affects your DNA, to the way it affects your everyday life, to how it affected you when you were a baby in the womb. So we're going to discuss the top 5 topics. We narrowed it down to that, but I strongly recommend that you listen to it because it's really, really insightful. And as we talk about these topics, I would like to invite you as the listener to both consider yourself from the point of view of the adult, potentially parent, um, and the child who was potentially undergone trauma themselves. So I'd like for you to keep in mind the fact that you're both the child who was traumatized and the adult who is trying to heal, because we're going to cover pretty much the spectrum of the lifespan. Um, Dr. Ana Maria, is it okay if we jump right in? Would you like to do a quick intro? How would you like to move forward?
Yes, we can jump right in, but I wanted to piggyback from what you just said,
Yep.
keeping in mind that when you're going to heal and you're doing work with a therapist or a psychologist, most likely you're not going to be dealing with your adult self. And in trauma treatment, we call that part work. There is something called internal family systems. And there is also the concept of adult, parent, and child within the ego stages. So you're absolutely correct. When people go into trauma treatment, most likely you're going to be very much in touch with that inner child or that exile part of you, which is the most vulnerable part of you.
Yeah. I'm going to give a quick definition of what Dr. Mate says he defines as trauma. In
Uh-huh.
the book, in particular, we've had our own definition of trauma, but because we're going from the book, I want to also give you his. He defines trauma as a wound that fragments the self. So, trauma separates us from our bodies, suppresses our authentic emotions, limits our response flexibility, and creates a distorted worldview tinged with fear and suspicion. It keeps us trapped in the past, robbing us of present moment awareness and limiting who we can become. Early childhood trauma can even interfere with healthy brain development. So that's his kind of the synopsis of what his writing states for trauma. Okay, so let's go ahead and jump in. The first thing that we got from the book is that trauma can be one of the root causes, one of the main root causes of physical illness, and not just mental health. So in the book, he talks a lot about how we have a mind body connection. And that's always been something that I think Dr. Ana Maria and myself agree with, is that you are a whole person. You're not just your brain, you're not just your feelings, you're not just the heart or legs or arms, you are a whole person. And that includes your mind, your emotions, as well as your body. And when your trauma affects you mentally, affects your emotions, it will inevitably affect your body. The book speaks quite a bit about women who are 3 to 10 times more likely to develop physical illnesses, including even to the point of breast cancer being found to be one of the illnesses. But not just that, you also have things like fibromyalgia, um, diabetes, obesity. These things, like women are 3 to 10 times more likely to experience it, especially women who have gone through sexual trauma and feel the need to suppress their emotions because that is what feels safe, or women who become fawn type people, like people pleasers because of their trauma. They're these individuals who essentially put aside their emotions and their emotional needs and for the sake of making other people feel good about themselves or making or making room for them. Um, there are there's quite a bit of research that's noted in the book that those individuals, you can pretty much say, oh, this person is an extremely nice person. They're probably going to develop an immunological disease, or they're going to develop cancer, and it's all because of suppressed emotions and suppressed emotional needs as well. So-
Okay, so I want to kind of like say something, if I may, about
Mhm.
this. Dr. Bessel van der Kolk wrote a book called The Body Keeps the Score that is very specific in terms of connecting trauma and the way we somatize it, how it causes physical illness. I think since we have been tapping into this idea of the vagus nerve, one of the things that it does is stores the pain in the body, emotional pain in the body, and understanding that chakras are not just energy points in the body that the Eastern medicine talks about is a thing with the vagus nerve. I think that that could be an addition to this wonderful book that you are recommended, The Myth of Normal. So the body keeps the score definitely goes a little more
Yeah,
in detail with regards to the connection between the body and trauma. And I also want to say that for practitioners, it is very important. I don't know about you, Jalili, but I definitely do a wellness assessment with each client to know exactly what's happening in each area of their lives and to be able to understand them better. Hence, my practice is called seven counseling because it's the seven aspects of wellness. Some people use more than seven aspects when they do the assessments. But yeah, thank you for noting that the body definitely knows what's going on in physical illnesses related to emotional pain.
yeah. I was actually talking to a patient during a session a couple days ago, and I brought up the book and I was recommending the book, and I had no idea, but she says, "Oh, well, I have fibromyalgia." And I'm like, "Oh, well, how funny because we were just talking about going into her trauma and like talking about her trauma. And that's why I even recommended the book." And I'm like, "Oh, well, that makes so much sense."
Bingo. Right.
So, and I have family members that have fibromyalgia that I know have been through traumatic experiences as well.
And
And uh,
I think you're talking about fibromyalgia, but the spectrum of autoimmune diseases that
yes,
are kind of
yeah,
like doctors treat
Hashimoto's,
them. Doc-
Hashimoto's.
yes, doctors will be treating those diseases, but I think there is that big question mark as to what exactly caused this, where is exactly coming from.
Yeah, because autoimmune diseases have become the almost like the trash bin of diagnosis is
Yeah,
like, well, we can't medicate you for this, which is commonly
but
known. We can't medicate you for this because which is commonly known, but you don't have enough symptoms. So let's just dump all of your symptoms into one name and then put a label on it and then throw a medicine your way and see if somehow it helps. And then if you have a side effect, let's give you another medicine. And if you have a side effect to that, let's give you another medicine. And next thing you know, you're taking 5, 6 different pills for essentially a diagnosis that is a unknown, because it just can't figure out why your body's beating itself up and literally trying to sabotage its own healing.
And something as simple as you were discussing obesity, when we were talking about this, people eat out of comfort and we feel so much with the gut. It's called a gut feeling for a reason. So, those connections between the stomach and the heart and the brain,
Mhm.
they're coming through. They're very important to notice that it's just not you eating for the sake of eating. Why am I eating if I'm not hungry? I just still want to eat. Definitely, there's an emotional wound there.
I know whenever I feel very anxious, like my stomach is the place where it goes. Like I can tell when my anxiety takes off because my stomach starts to turn into a knot, and I
Mhm.
just like it's hard for me to feel comfortable. And then when we're talking about the physiology of anxiety, for example, when your cortisol is going up because you're anxious, or stressed, if you're overly stressed, your cortisol is going up and you feel bloated, you feel like I know personally that's how I feel. Whenever my cortisol is high because of stress, I literally feel like I just ate a watermelon, and it's like I haven't eaten in hours, but for some reason I'm like full of fluid and very, very uncomfortable.
And the reality is that you're not going to lose weight for those of you who are trying if you're stressed out because that cortisol is going to store the fat. It's on fight or flight mode and it doesn't know that you're just stressed out because you can't pay your bills or your kids are misbehaving or so yeah, you're absolutely right.
Right. So another thing that you brought up that I think is very important to just add on to is, yes, if you are listening and you're a mental health provider or a medical provider, please do an assessment of your patient's overall life experience. There's a there's a reason why people feel the way they do physically and emotionally, and it
Mhm.
may go deeper than just, oh well, I woke up and I had this ache or this pain or this headache. um I think that one of the things that the book emphasizes a lot is that doctors don't ask. Like, they will not ask a patient who's coming in with severe migraines, for example, what is your life like? Are you stressed at home? Are you going through a divorce? Are you overworked? What was your childhood like? How did you cope when you were a child? How do you deal with stress? Do you have a therapist? Do you go to the gym? Do you take vitamins? How do you eat? Like, doctors don't ask those questions. The same way that many therapists don't go into the in-depth questions of how often do you exercise? Do you take vitamins? Do you eat healthy? Do you drink enough water? When was the last time you went and got a physical? Like, we don't ask those questions either. We go straight to the emotional part and ignore the physical. And sometimes I think we're scared because maybe we're not considered doctors, and so, like, it's like, oh, well, I'm not going to talk about the biology of your body or the physiology of your body because what if I say something wrong? Because I'm not a psychiatrist or I'm not a medical doctor. So let me stay away from the body. But, and vice versa, the medical doctor may be like, well, I don't know. I'm not a therapist, so I'm not going to talk to you about your feelings. So let me not go into your trauma because then we're going to sit here for an hour talking about your childhood.
And by the way, I want to add something real quick. There are some somatic treatments that people can access through psychotherapy that are very important. So it's not only just talk therapy. There are somatic ones that you can do as a therapist, but you're going to need to know about the body, not the biology, not the anatomy, not the chemistry. But like you said, it's something that we should go into for sure, asking questions,
Yeah.
being curious.
And being thorough, looking at the
Yes.
person as a whole person.
Yes.
Okay, so let's move on. The next one is cultural context. And so Dr. Mate goes into how systemic factors in a person's life, whether it's where you live, what country you live, what neighborhood you live in, whether it's your cultural background, how you were raised to think of mental health, how you were raised to think of emotions and of parenting, affects and is very, very important to the social, like to your structure, the structure of your mental health and the structure of your physical health as well. I think about oftentimes we have parents that are like, well, I don't believe in mental health, but I'm bringing my kid because they've been acting out, and they literally drop off the child and then
Fix
they
my child.
leave, and they leave, and an hour later, why isn't my kid fixed?
Fix my
And
child.
and then the child goes back to the environment that these parents are creating, and they can't help but regress and go right back to the same behaviors that they had before. But mom and dad don't believe in mental health. They basically just wanted to bring them in because the child is considered bad. You're being a bad kid. Do you have thoughts on culture?
Oh yeah, absolutely. I just didn't know if you were done giving
What do you mind? I'm off the soapbox.
no, it's all right. Yeah, I was thinking that in terms of theories that approach human culture, there is one that talks about people being very complex, and every aspect, again, of their lives makes them who they are. So culture could be anything. Sometimes we just think in terms of age, gender, color, ethnicity, and it's really much more complex than that, because it's your experience. Every person is a universe of their own. So you are born with this set of characteristics, and then that's nature, but then there is nurture, and whatever is going to develop is going to depend on the nurturing aspect of things. So maybe, okay, you were born in the Midwest, maybe you are white, maybe your parents are from a Catholic background, maybe you have siblings, maybe you go to school and you do 12 grades, maybe you participate in sports, maybe you have the tendency to be extroverted, maybe you have the tendency to have anxiety nonetheless. So all of those things really make the person who the person is. And yes, everything counts. Your surroundings, the people that have a lot to do with putting programming in your brain. That means your friends, your teachers, your family. Definitely, that's the core of, I think, sometimes traumatic experiences that may seem very small. It could be a word that you heard all the time.
Mhm.
I had a client that couldn't hear the word disappointed because it was a huge trigger for him. Where did that come from? Having a very critical dad that will not be telling him he's a loser, but he would saying, I am very disappointed at you. I am very disappointed at you. I'm very disappointed at you. And that's just the environment. So is the word disappointed bad in itself? No. Is this a huge trauma in the grand scheme of things? For the client, it is. So yeah, definitely culture and the parents have not only parents, everything around you have a lot to do with how you develop and what your wounds are or are gonna look like.
I think about a couple of things. First, I've been doing more and more research on eating disorders because I feel like more and more of our youth are coming into the clinic with eating disorders, especially females, coming in not just cutting disorders, but also eating disorders. And as I talk to my fellow therapists in the clinic and we discuss these cases, we're talking about almost all of the time. It's these girls that are in family homes where there is strict rules. The girls don't feel like, literally, it's to the point where if they misbehave, they take the doors off the hinges. They read their journals. So the therapist can't even recommend to the child to journal their emotions because the journals get read. So they live their lives in constant fear of being caught doing the wrong thing. And if they're not perfect all the time, and if they're not always in line with the expectations of the parents, they get punished, and the punishment is almost always something that leads to a feeling of shame, a feeling of worthlessness, a feeling of guilt. And these are children who are in the second part of development in their childhood. They're 10 years old, 11 years old, 12 years old. So they are just now learning the second part of development in terms of their identity. So they went from being a child entirely dependent in their identity to their parents to now they're trying to make their own identity. But these very, very perfectionist parents, these very strict parents, are creating an environment for the child where the idea of being an individual is punished. And I see that a lot in immigrant communities. I see that a lot in um, the Latin community, but not just the Latin community, in immigrant communities in general, where you have to perform, you have to be perfect. You can't compare yourself to your white counterpart or that your friends because you come from a different background and you have to be the exception because maybe your family's depending on you, or maybe you're going to be the first one to graduate from college, or you're going to be the doctor of the family, you're going to be the lawyer of the family. Um, these things are putting so much pressure in our children. They oftentimes have multiple extracurricular activities on top of also going to classes, oftentimes advanced classes. So the environment that the parent creates for the child is extremely stressful, and so they're taking it out on their bodies, which is back to what we're thinking of, the mind body connection.
Yes, that's very true. And also, I mean, with parenting in psychology, we divide parenting styles in different ways. You can say that there is the secure parent. Ideally, we all want to be secure parents, but we try what we can. We try our best because we carry that from our own parents as well. So we try to be secure parents, but there is the anxious parent. That is probably what you're talking about. I need my kid to be perfect. I need to go ahead and control every single move. The helicopter parent, I
Yeah, the
guess.
helicopter parent.
There's the avoidant parent that doesn't want to be involved, is present physically, but not in the mind or not really there with the kid. And then the disorganized parents, and we see that a lot. I think, parents that are not thinking about the wellness of the child, but themselves. And all of those parenting styles have to do with the development of trauma, as you were explaining, eating disorders for parents that are very controlling or anxious.
Mood
Uh,
disorders. So we got
Correct.
mood disorders like bipolar disorder. We have borderline. We definitely antisocial personality disorder and oppositional defiance disorder come from insecure or ambivalent parenting, avoidant parenting, um, those types of. It's all about when you take it to the extreme. Because you can be anxious about your child's well-being, for example, or even their performance at school, and you can have high expectations of your child, but it's when you take it to the extreme where the child literally feels like their entire identity and their entire well-being depends on their performance, and they're buying their love from you by their performance. They're literally buying your acceptance of them as a human being, and they don't get to be just themselves naturally. That's where you really see that there's that break, uh, back to how Dr. Mate was describing the trauma. There's that split in your perception of reality and of life.
Well, let's just say that you have a child that naturally is a sensitive child, that is an empath or that is a highly sensitive person. And then you have a parent that is absolutely critical. And that really is going to create a lot of conflict because maybe one of your kids is not as sensitive and they can take it. And that's okay. And maybe your sensitive kid will not be able to, quote unquote, take it.
That's right.
So they're gonna develop those narratives that you're talking about. The only thing that I can control is what I eat, and maybe an eating
Right.
disorder were to happen.
And Dr. Mate talks about it's not about what we perceive as parents to be the quality of our parenting. So, like, it's not about, oh, well, I think I'm a good parent. It's not about what we perceive as good parenting. It's what the child takes in, has good connection. So it's, oh, well, I think I do a great job as a parent. That's pretty much useless. Look at the kid. How is the kid growing up? How are they
Behavior.
living? How are they behaving? And that's how they are taking your parenting in. Because you might think of yourself as a decent parent, but if your child is suffering from, behavioral disturbances or just self-harm, things like that, it's most likely because what they are seeing on their end and what they're receiving of your parenting may not be. And two children will receive your parenting in two completely different ways. You can have multiple kids in the house, and each one of those children are going to perceive your love in a different way. So you do have to be aware of the fact that every single child is in fact a world of their own. So going back to what I originally told you guys, now take what information we're putting out and look at it as you were a child experiencing the parenting of your parents and the love of your parents, and what you were perceiving has the connection with them. And then also take a step back and look at yourself as an adult now, and how does the two work with each other? Was your parent an anxious parent? Was your parent a dictatorial parent? Was your parent an avoidant parent? And how are you now as a parent? Are you a helicopter parent? Are you an avoidant parent? Um, are you fearfully attached or anxiously attached or insecurely attached? Has a partner in a relationship, has a friend, has a coworker, etc., etc. Because the two have a lot to do with each other, and that's where you know it all sort of like just is a linear connection. Okay, the third one is the importance of connection. So we were just talking quite a bit about that. So I'm just going to go very briefly into, it's not just about parents. It's not just about your connection with your kids. It's also about the connection with society. Do you feel like you have a part in your everyday life? Do you feel like you belong when you go to work? Do you feel like you belong when you go out in your community? Do you surround yourself with supportive individuals in your community? Whether that's spiritual community, whether that's friend group, whether that's hobbies, or are you isolated? Isolation is one of the worst things you can do for your mental health. One of the worst things you can. And God knows I'm guilty of it, but I will force myself to garner connections and to look for healthy and supportive connections, because I know how unhealthy it can be.
But you know what? Now that you're touching on this, I feel like there is a loneliness epidemic worldwide because people are very suspicious of forming bonds with others and being vulnerable and getting hurt, and rightfully so. I just, sorry for saying this, but I think the world sometimes seems like it's upside down, and people just don't want to put up themselves out there to get hurt and to have connections that may seem fake or unhealthy, so they prefer to be alone. Touching on this subject of belonging, if I may say real quick,
Yeah.
Abraham Maslow, he's an icon in psychology, and he developed this pyramid of needs a long, long time ago, sometime last century, I want to say mid last century. And
In
he
the
was
olden
talking
days.
about, yes, he was talking about how beyond the basic needs of food and shelter and clothing and things like that, having a property, feeling like you're earning money, you have a job, it is extremely important to have that sense of belonging. Feel like you are part of something, like you're attached to something, a group of people, you're part of a clan. And I
Mhm.
also wanted for the people who are listening and have been following Little Monkey Punch journey. It shows exactly what we are primally as humans, because we're also animals. This little monkey was abandoned by his mom in a zoo in Japan, and he was given a stuffed animal an orangutan stuffed animal that he holds onto for his dear life. And now he's making more friends in the zoo and he's integrating into the community. But it shows the importance of belonging and attaching to other people, being part of something. We're social animals, that's for sure.
And okay, so I want to go back to what you originally said about our fear of creating connection. I will dare say that that in itself is a trauma response.
Of course.
I think that our own insecurity is going to so basically here's the way I see it. If you have healthy coping mechanisms, you can take rejection well. You can take it generally well. You can take it well enough that it's not going to crush you. You can test the waters with connections, whether that's a partner, whether that's a friend, whether that's a hobby, a group, whatever. You can test the waters and get rejected and still bounce back. If you have not developed healthy coping mechanisms, rejection can feel like the most painful thing on the planet. It can feel crippling and it can reinforce your own idea of you're not worthy, you're not good enough, your own ideas. So if your trauma is around the feeling of worthlessness
Abandonment,
or
rejection.
abandonment, worthlessness, shame, guilt, things like that. I need to be good enough. The idea I need to be good enough. And if I'm not, then I'm not a good person or I'm not worthy of this life. If your trauma is around that, yes, forming bonds with other people is going to feel like a literal like a minefield where you're like touching every relationship fearfully, because goodness forbid it blows up in your face and then it proves to you that your trauma is real, that what people said about you, your parents, whatever, is true. You're not worthy of connection, you're not worthy of friends, you're not good enough to be with. So I think that as you process your own trauma and you learn to figure out where it comes from and what it represents for you, um, connecting with others will become a little bit easier.
I do want to say something, if I may, about this connection thing, because I feel like when something happens over and over and over again, the idea is that the human being learns that this one thing that we're doing over and over again is not giving us results the way we expect. So at some point, the person is going to self-preserve because that's survival instinct, right? So the anxiety of connecting may be there, and I think that that's probably not as conscious sometimes these days for a lot of people.
Yeah.
Then again, I think it's because of the quality of connection. It's not necessarily because the person is prone to trauma. I feel like by going over the same experience, being burned over and over and over again, you decide, well, maybe I should just go ahead and exile myself here to this corner so that I'm not putting myself out there to be bothered or hurt. And I think that's just a natural response of protection, self-preservation, protection. But like you said, it's a trauma on its own. It's just, I think it's the quality of human connection these days. It's not just the person sense of worth, if that makes sense. It's just like quality, the way we communicate is a little different. The way we bond is a little different.
I think that when I talk to people who struggle with connection, I'm one of them. As introverted as I am, funny enough. I'm a work in progress, okay? As I talk to people who have struggled with connection, um, I almost always hear the question that they ask is, why did this person do this to me? Like, why, they'll be like, or they'll say, why am I always attracting the narcissist? Or why do every person that I date turns out to be a narcissist? And I think that even though it's a valid question, I think it's not the right question to ask. I think the right question to ask is more like, what is the environment that I'm creating for myself, physically, emotionally, mentally, that attracts people who think that it's okay to do this to me, who feel like I'm not going to set the boundaries? Because somebody who creates the right environment for themselves, the right attitude in connection, will pick up on the red flags. Like those people will come into your life for a minute and they'll be right out the door just as fast
Mhm.
because you've created the environment in the connection that those people are not welcome. And you don't even, it doesn't even get to the point where you connect with them all the way. Like it's a couple of meetings in and you're already noticing, hey, you've been pushing my boundaries, you've been trying to get you're crossing the line, blah blah blah, I see you as you are. The conversation's over. But if you don't have that kind of mentality, if the environment that you're creating to attract the connection, the person, the friend, the partner, whatever, is unhealthy, comes from a place of anxiety, comes from a place of fear, comes from a place of insecurity, yes, you are, it's the perfect place for those negative people to come into your life.
Yeah, I think it's important when forming connections to be aware of who we are. I think
Yes.
know thyself, and that's probably a good way to start. So, if we're trying to form healthy connections and we have some sort of trauma because something happened in the past, we can start looking in terms of, okay, well, if I'm fishing for salmon, I'm not going to go to a pond where there's catfish. So, just putting ourselves, like you said, in the right environment is a good start to form healthy connections with people. But the importance of attachment definitely sometimes is no,
100%.
all the time is impacted by trauma. That's for sure.
100%. The other thing too that I want to talk about when it comes to the connection is, um, don't feel like just because I know a lot of people that have mental health concerns and diagnosis, et cetera, who feel like they don't deserve to be in environments where people are healthy, who feel like they don't deserve to be around healthy people because they're the problem. I'm the drama. I'm going to just cause drama. I'm just going to cause, I always bring everybody around me down. I make things difficult for others. um, don't feel like you're not good enough to surround yourself with healthy people because you need healthy people around you to support you so that you can be healthier. And if you're honest and open about yourself and you're like, I'm a kind of a work in progress, and but I want to be surrounded by people that are going to help build me up. That's something that's very much welcomed in any relationship that's healthy.
Mhm.
Okay, the next one, we have two more to go. So, number four, reframing illness. And as we're talking about this, seeing yourself as your illness, seeing yourself as your diagnosis. Um, Dr. Mate talks about viewing mental health symptoms not as labels, but as understandable adaptations to life experiences. So, Dr. Ana Maria also brought up a very good point on the diagnosis. Do you want to discuss what you were saying about
Absolutely.
the DSM-5?
Thank you. Yeah, I was biting my hand here not to interrupt you with because I'm like so passionate. I am crazy passionate about this that we're gonna just touch on right here.
I got you.
So many months ago, when I was training in DSM-4, okay, so this is long time ago, I actually went to the conference where the people who wrote the DSM were present, and they were talking about the changes that there were. Yes, don't judge me. It's the DSM-4. It's a long time ago. But anyway, so in this conference, one of these folks who helped put this book together, the first thing that he said, and I will always remember this, he said, psychological diagnosis in the DSM is not for people to take ownership of. It's for mental health professionals and health professionals across the board to communicate with one another. So, in other words, we're just trying to understand the person that is sitting in front of us and call it something. It is very different than medical diagnosis. Medical diagnosis is factual because you test a hypothesis 1,001 times, and the result most likely is going to be the same. Diabetes is diabetes here and in China. But with mental health, it's more about observation. You have to take into consideration the context because we don't know if things are overlapping. You cannot just go ahead and say, "I this person has attention deficit." Well, maybe the attention deficit is stemming from trauma and there's an overlap. There's co-occurring issues. There's the whole cultural aspect of things. For those mental health professionals that haven't taken the time to read the last part of the DSM, because why would you in your spare time? There are some exclusions to diagnosis, and you have to really look at this. For example, cultural issues. If a person comes in telling you that they have mal de ojo, I don't know how to
The
explain that
evil
in
eye.
English, like
The
evil
evil.
eye, yeah. Somebody look at you sideways and then you got rotten luck for the next 7 years. I don't know. That's a very cultural and very specific thing. It doesn't mean that the person has schizophrenia or is imagining things.
Mhm.
So yeah, thank you. That's all I have to say for now. And it's ever changing.
Mhm.
Notice how it's ever changing. We had hysteria at the
Mhm.
beginning of last century. That's no longer a thing, thankfully. We had homosexuality as a disease in the DSM. That's no longer a problem. Now we have included in this DSM-5 caffeine addiction. I'm guilty of it. I'm Colombian. I drink coffee all day. Asperger's has been absorbed by the whole autism diagnosis. So we got to take it with a little bit of grain of salt. Yes, the professionals, we need this as a language, but it's not for you to take ownership of this. It's not for you to go around going like, "Hey, good morning. My name is Anamaria. I am anxiety." We don't introduce ourselves that way. So, yeah.
I I agree with you so much, and I think what patients don't realize, obviously, and they don't need to because it's it's something that happens for us as providers, but they don't realize that it's really important for us to be able to categorize the symptoms into a group because I can tell you in my own experience, if you have the symptoms of bipolar disorder, I know immediately that cognitive behavioral therapy, CBT, is never going to work for you. So I can spend the next 10 years trying to CBT the heck out of you. And I know it's not going to work and you're going to feel like a failure and the therapist is going to be a failure and it's never going to actually help you. On the other hand, if somebody comes in and they have anxiety, um, obviously CBT would be very helpful. So for us to be able to categorize in general the symptoms helps us to know how to treat you better and
Perfect.
treat you
Yes.
properly. Um, because it's not just one thing fits all. Like if I have somebody with an eating disorder that also has a generalized anxiety disorder, I know that I have to do food education, I have to do nutritional therapy, which is a completely different type of therapy, as well as CBT, as possibly well as EMDR. So there's so many different layers to it. And the worst thing that happens is, like Dr. Ana Maria said, the patient has a hard time when they are diagnosed not taking ownership of the diagnosis as if it became literally another skin, a second skin.
Yeah.
And the fact of the matter is you are no less yourself 5 minutes after you were diagnosed as you were 5 minutes before the diagnosis. You're still the same person that wanted to to help themselves. You're still the same person that identified that there was something you needed support with. Go ahead.
I'm sorry, but the connotation notice that is completely different when you're given a physical wellness diagnose as opposed to a mental health
Yes.
diagnose. And I can see why, because the people perceive psychology and mental health still with this stigma of something that ooh, we don't understand. I have a lot of folks still that think that you come to the office to lay on the couch, that we're gonna do psychoanalysis, that if you misbehave, you're gonna be placed in a mental facility with a
Institution, yeah.
straight jacket. I mean, my goodness, we create horror movies solely based on the psychological aspect of things. If you're crazy, you're gonna go to the mental asylum.
That's right.
I know the name of the book is The Myth of Normal, and I love, love, love this name for this book because I dislike the word normal immensely.
Mhm.
I don't know what normal is. I think we're talking maybe about balance, being healthy for other people and for yourself. But these days, who dictates what normal is? I mean, apparently, being too sensitive now is a diagnosis. Highly sensitive individuals is a diagnosis. So maybe in the future, if narcissism is the majority, is the norm, does that mean that it's
Right,
okay? So we need to question ourselves in terms of like, what's normal?
right. So when it comes to reframing the illness or the diagnosis, I would recommend, as somebody that does psychiatry in my clinic, which often triggers a lot of people's emotions as well as mental health. um, we strongly encourage the patient to ask questions about their diagnosis, to make sure that they have provided as close to the truth and as close to fact as possible to the provider. Like, tell your provider exactly how you feel, as close to what you understand of your feelings as possible. And don't think that you have to somehow make us happy. Like, oh my gosh, I came in for anxiety, but am I anxious enough? Or am I depressed enough? Or, well, I know that the anxiety scale is saying that I'm not that anxious. Is there something else wrong with me? Like, it's okay. Be honest about how you really feel. And if you're concerned about the diagnosis and you feel like that doesn't seem like me, go ahead and ask for a second opinion. We have testing now. We do the diagnostic evaluation is a 220 question questionnaire. Yes, I graded myself, so imagine how that goes. And it's 220 question questionnaire. And the reason why I obsessively encourage our therapists and our psychiatric nurse practitioners to use it is because oftentimes people feel like, well, unless I know confidently that my diagnosis is being taken seriously, then I really can't get past the title. I cannot get past the diagnosis if I don't feel confident about the way it was brought on. So we're trying to make it a little bit easier to deal with the diagnosis, but the fact is, at the end of the day, your symptoms are your symptoms. They were there before the label, and they're going to be there as long as you are in process of healing. The most important thing is not to look at the label. The most important thing is to look at the whole person. What led to my symptoms? Where do they come from? Where were they born from? Who were they born from? And how can I start the process of healing? Any final words before I move to five?
Yeah, I know that diagnosis is the meat and potatoes of our profession, and it should be because once again, it's for the uh, greater good in terms of treating the client. That's why we're doing it. You're absolutely correct. We're trying to understand the person better. It's not a label. I want to say that you that are listening, we that are talking, we're just human beings having a human experience. We're trying our best. And the
Mhm.
fact that you have had a diagnosis in the mental health field doesn't mean that you are defective. We all are trying to make it in this boat of life. So it's just a way for us to understand you better and to give you better care.
Yeah. Yeah. Your providers are not judging you. As far as I mean, I listen to therapists all day long as a supervisor and as a practitioner myself. Your therapist is not judging you because of your symptoms or your diagnosis. Your therapist is putting together the a plan of action to help support you. Our goal is always, how can I be the
How
person?
can we help you?
Yeah, how can I be the person that makes a difference in this patient's life? All right, so number five and the last point, how can you approach trauma in a way that is actually positive, encouraging, and healing? And Dr. Mate talks about holistic healing, um, involving authentic expression, self awareness, and a sense of agency. It's very, very important for you to start taking back control of your own decisions, your own emotions, your own life. your own instincts. When you stop and you recognize, I am repressing this feeling. Why am I repressing this feeling? Maybe somebody upset you and you don't want to inconvenience them. So you repress the frustration. Why am I repressing it? Why am I not expressing myself openly? It doesn't have to be disrespectfully, but it should be honestly and openly. Hey, I don't know if you meant to do this, but it was very, very hurtful that you said that to me, or it was very offensive, or again, back to the idea of agency, recognizing I am a people pleaser, and that's not healthy for my physical health or my mental health. How can I start working towards learning to set healthy boundaries with others and with myself? Because you also have to start setting boundaries with yourself. No, it's not okay for me to just give all of my time to everyone else. I also have to set a boundary where I respect my time as well. Same with attention, same with care. So looking at the idea of healing from self-awareness and from learning that emotions need to be felt, they need to be expressed. Dr. Anamaria, jump in.
Yeah, sorry, I was making faces here. You guys can't
I
see
love it. I
us,
love
and I make a lot of faces, so she knows that probably that's my cue that I want to say something.
it. Yeah, very
So
helpful too.
I was thinking that this holistic healing that he's talking about, the way I look at it is kind of like updating the software in your computer. Your brain is your computer, and you have the power and the tools to recreate yourself. But you have to be aware, like you were saying, Jalili, that some things are there. So yes, how did that start? It started because, well, I grew up in a house where this was happening. I grew up in a country where this was happening. I grew up in a time where this was happening. I'm a female. This is my experience about the world. All of that is great, recognizing it. But then, how are you going to update that software that is no longer helping you function in the world with your brain, your computer? So that's reframing the quality of your thoughts, but also keeping up with your body. Your body's like a car that you go through life driving, and you also have to take care of your body. So I feel like the Greeks long, long, long time ago had it right. A healthy mind and a healthy body, and everything is one thing. We are wholesome. We are not just one thing apart from the other thing. Uh, so
That's right. If I was to give a simplified example, because I know that sometimes when we give like abstract feedback, like, oh, do this random thing, like it might be hard to understand. Here's an example of a person who's in the process of healing that can use the holistic approach. First, look at yourself in the mirror. Start by asking yourself, what do I see? And am I satisfied with the person that I see? And what are some things that I'd be willing to change, that I'm interested in changing, that I can start working on? Whether that is your physical looks, whether that is the amount of exercise you do, whether it's the way that you treat your body. It can be the way you treat your skin. It can be the way you treat your teeth. It can be the way you treat your weight, your hair, your clothing. Look at yourself in the mirror and start creating the foundation from the inside out. But then take it further and look at your environment. What do I see in my bedroom? What do I see in my living room? What do I see in my house? Am I satisfied with the way that my house looks, my bedroom looks? Am I satisfied with the way that I relate to my spouse or my partner? Am I satisfied with the way I relate to my children? Where does it come from? How can I change it? Am I willing to change it? Can I find one thing to start changing? And then take it even further. How do I feel about my job, my friends, my my groups, my school, my careers, etc., etc., and ask yourself, am I satisfied with the person that I am in these environments? And then start making changes gradually. has you become more aware of the things that you are willing to change and that you would like to change and that you have the power to change. Start with the things that you actually have power to change, like yourself, and then move on to more and more of your environment.
I think that that's a lovely idea, but I think that people need to be in a certain place to be able to look at themselves and be that honest. So if you're not ready or you don't know where to start, that's what the mental health practitioner is there for.
Mm.
We start with naming things. We start with acknowledging emotions, which is so very important, guys. Like, I think that we are carrying this idea from last century that emotions are pesky, they're bad, they're useless, and that's not true. So the healing process may start with going to see a mental health therapist or a psychologist and talking about your truth, calling it what it is, and then that probably will get you ready to be able to look at yourself in the mirror with more honesty and more willingness.
Or and I agree with you on that, but if you are talking to the therapist and you still feel like you're struggling, because it is a process, it's not going to happen overnight. So if you are talking to the therapist and you're like, man, I really want to start this process, but the looking in the mirror part is just too much for me. Maybe the trauma that you experienced was sexual trauma, was physical trauma, and your physical self doesn't even feel like it's you. Your physical self, the person that you're looking at in the mirror, is not who you really are, but you don't know how to relate to that other person that's looking back at you because that person was maybe victimized. And that's where
Mm.
the crux of the problem is, and that might be too big. That's okay. You don't have to start with the mirror. You can start with the environment. You can start with your job, you can start with your school, you can start anywhere in the process. You can start anywhere at any point, wherever you feel safer, you can start there. And you can start with small things, whether it's, well, I'll start by making my bed, or I'll start by putting away this pile of clothes that I always keep on a chair, or, like small things can still make a difference, and that's okay.
Yes, of course. Yeah, you start where you are, that's for sure. And we as mental health professionals, we meet you where you are. That's our job. I also wanted to say that sometimes people know that they want to give up this hot potato or this hot coal that it has been burning in their heart, which is trauma forever. But on the one hand, as much as they want to give it up, on the other hand, it defines who they are. So they find themselves having this dance coming to the office like, yes, I want to work on it, but I don't want to relinquish it because then who am I without it? And that's totally okay to feel, guys. If that's where you are in terms of trauma treatment, I want you to know this is expected
Mhm.
and just give it time. Like Jalili was saying, it's a holistic process.
Yeah. And don't be afraid to tell your providers, like your medical providers, for example, that you need them to go a little bit more in depth with their questions, or open up to them, like tell them where you think that your symptoms may be coming from as well, or what you need them to check. Because if they're not asking the question, it's okay for you to bring it up. Like, maybe it has something to do with this, or it may have something to do with that. Like, I remember making a call to Dr. Anamaria. We were just chatting, and I was telling her how frustrated I was because my primary care physician, I went to him because I was feeling really, really like physical symptoms of high cortisol and high stress. I was feeling the physical symptoms, and my provider, my PCP, was just like, well, you have generalized anxiety disorder. You need medication. Go see a psychiatrist. That was literally what he said to me. He didn't touch me. He didn't palpate me. He didn't check my thyroid. He didn't order a lab test, nothing. And I felt extremely frustrated because I'm like, okay, so you took one look at me, you asked me three questions, and then you said I have anxiety, and then you said go take a pill. But I knew that there was a physical component to it. I know because I'm a therapist that there are physical components to anxiety. So I didn't deny that I was anxious or stressed. Of course, I'm stressed. I own a business. Every day I'm stressed. But I also knew that there was something physically wrong. And so I started taking steps myself, and I went and I did acupuncture, and I went and I started taking magnesium, and I started taking zinc, and I started doing meditation. and increasing my exercise. And voila, somehow the symptoms went away. I still have stress every day, but my physical symptoms are not there because I also addressed that.
Well, going back real quick, and I won't say anymore, I promise, but going back to the beginning with the somatic expression
Yes.
of emotion, your body knows and your body is giving you the signals. Pain is a signal, emotional and physical pain. So you guys know what you're going through. And like Jalili said, if you feel like your practitioner is not asking the right questions, you can give the right information to them because you're the one that is in your body. You are the one that lives in this shell and you feel what that is like, and just listen to your body like she was saying, if they're telling you disregarding the fact that you feel something in your body by telling you you need to see a psychiatrist, go take something for anxiety, then either you take it upon yourself or you can get a second opinion
Hmm.
or you can advocate for yourself.
Hmm. Yeah, I agree. Okay, so thank you, everybody. We typically try to keep it really short, but this was such a good book. There's so much information that we left out for the sake of time. I strongly recommend that you check it out. The Myth of Normal by Dr. Mate. Also encourage you to check out The Body Keeps the Score. Um, both of them are amazing books, and we're going to be back a couple of weeks with another episode. Um, I'm thinking of the topics that we're going to hit on. I don't know. It might be something to do with parenting, maybe child rearing. I don't know. This whole trauma things is really, it's in my mind, and I'm thinking about it. So we'll talk. We'll see. And I hope that you guys tune in for it. But thank you so much for staying tuned and for listening to us. And we hope that you have a wonderful, wonderful day. And just remember, you're beautifully and perfectly made, and you belong, and we love you. And we hope that you remember that every single day. And thank you very much from Insights from the Couch.